What is epilepsy? Epilepsy is a condition that affects the brain, which means that when someone has epilepsy, they have a tendency to have seizures. Seizures occur when there's excess electrical activity in the brain. It affects 1 in 100 people in the general population, but it affects 1 in 5 people with a learning disability. What causes epilepsy? In over half of all the people with epilepsy, there's no identifiable cause. Epilepsy is more common in people with a learning disability because of the way their brain has developed. There can also be a genetic link to epilepsy, and some people have syndromes such as Dravet's or Lennox-Gastaut syndrome, which are characterised by epileptic seizures. Other causes include brain damage caused by head injury or infection. What are the steps to follow during a seizure? For this, I'm using the epilepsy action information. A. Action. Assess. Assess the situation. Is the person in danger? Are they in danger of injuring themselves? Remove any nearby objects that could cause injury. C. Cushion. Cushion the person's head with a jumper, for example, and protect their head from injury. Time. Check the time that the seizure lasts. If the seizure lasts longer than 5 minutes, you should call an ambulance. Identity. Look for a medical identity bracelet. It may give you information about the person's seizures or what to do. Over. So once the jerking has stopped, put them on their side in the recovery position and stay with them and reassure them until they come around. Never restrain the person. We never put something into their mouth, and we never give them anything to eat or drink until they're fully recovered. What are the steps to follow post-epileptic seizure? Always remain with the person until you are certain that the seizure has stopped. The time following a seizure can be very confusing for the person, and it can take from minutes to hours for them to return to their usual form. If possible, place the person in the recovery position. Observe their breathing, their colour and their level of responsiveness, and make sure that they're returning to their usual form. Never ever give anybody anything to eat or drink until you're certain that they're back to their usual form. Is it always obvious when someone's having a seizure? No, it's not always obvious if someone's having a seizure. It will depend on the type of seizure the person is experiencing. During an absence or a focal seizure, it may not always be obvious. A person will have a brief loss of consciousness or responsiveness, and then they'll come back to their usual form. The person may still have a level of responsiveness, but they may be behaving in a way that's slightly unusual for them. What are seizure types? Seizures are either generalized, which means the entire brain is involved in the seizure, or focal, which means that only one lobe or part of the brain is involved in the seizure. Generalized. Tonic clonic is the most common generalized seizure. This is when a person loses consciousness. It's followed by a period of rigidity and then rhythmical jerking of the limbs. The person's breathing may be affected with a gasping or a grunting noise, and they may show blueness around their lips. The person may experience urinary incontinence, or they may bite their tongue during this seizure type. They usually last less than 1 minute, but they can last up to 5 minutes. If they last 5 minutes or longer, it becomes a medical emergency and you must phone for an ambulance. Absent seizures. Absent seizures occur when the person has a very brief loss of consciousness. They may stop and stare ahead for a few seconds and then resume their normal activity. Myoclonic seizures are a sudden, short-lasting jerk that can affect some or all of your body. They generally only last a fraction of a second. Tonic seizures. Tonic seizures start on one side or sometimes both sides of the brain. All your muscles tighten and your body goes stiff. You may cry out. There may be a change of breathing during this seizure type. It can happen on one or both sides of the body, and they generally last less than 60 seconds, but they can last longer. Atonic seizures or drop attacks. Usually all of your muscles go limp and you drop to the floor. This can result in a person receiving quite severe injuries to the head, nose or face. Focal seizures. Focal seizures affect only one area of the brain. Sometimes they can be a warning that a generalized or convulsive seizure is about to occur. In a focal seizure, the person may present with abnormal behaviour. They may stop and stare. They may have lip smacking. They may wander around the room. There may be plucking at the clothes. Or they may just act in an out of character way for themselves. They may get a funny smell, taste or sensation. And focal seizures can last as little as 30 seconds, or they can continue for a longer period. Focal seizures may also occur in clusters. Should I contact an ambulance if someone's having a seizure? It's not always necessary to contact an ambulance if somebody is having a seizure, but you must call an ambulance if any of the following apply. You must call an ambulance if you know it's the person's first seizure. You must call an ambulance if the seizure lasts for more than 5 minutes. If one seizure follows another without the person regaining consciousness, if the person is seriously injured during the seizure, or if the person has trouble breathing either during the seizure or following the seizure. Are there seizure triggers, and if so, what are the most common? The most common form of having a seizure trigger is somebody not taking their epilepsy medication as prescribed. Epilepsy medication is meant to be taken as prescribed, so if it's prescribed on a twice daily basis, that's say 8 AM and 8 PM, it's really important that we keep that 12-hour window in between administrations. Feeling tired or not sleeping well. This can be quite difficult for people with epilepsy, and it can be a very identified seizure trigger, so it's really important that people with epilepsy have a good sleep pattern. Stress, distress and excitement. These can be quite identifiable seizure triggers for people with epilepsy, and it's important to keep things on as even a keel as possible. Alcohol and recreational drugs. It's important not to have excess alcohol and to completely avoid recreational drugs. Flashing or flickering lights. So about up to 8% of people with epilepsy have what we call photosensitive epilepsy, which means they'll be sensitive to flashing lights. So this can include strobe lights or maybe lights from a light going on in the kitchen or something like that. So if this is an identified trigger, it's really important to minimize the person's exposure to this. Menstruation. There's a type of epilepsy called catamenial epilepsy, which means that women are triggered by their menstrual cycle. So this can either be the pain from experiencing a period or hormonal fluctuations from within the menstrual cycle. Missing meals. If you have a low blood sugar, this can be an identifiable trigger for seizure activity. So it's important that a person with epilepsy has regular meals and wouldn't have that triggered seizure from low blood sugar. Having an illness which can cause a high temperature. This can be quite a significant trigger for people with epilepsy, so it's really important that we avoid high temperatures and that they're treated appropriately if they occur, and that any infection is assessed and treated appropriately. Constipation, especially in people with a learning disability, can be quite a significant trigger for seizure activity. So it's very important that we avoid constipation and we promote good bowel health and a good bowel habit. So we must avoid constipation because the stress, distress and pain caused by constipation can all trigger seizure activity. Are there physical effects from a seizure, and if so, what are they? It depends on the type of seizure that you have, whether you'll have physical after effects of a seizure. So after a tonic clonic seizure, you may have a headache or feel sore, tired or unwell. You could be very sleepy. You could have problems with confusion or have memory difficulties. The length of time it takes after a tonic clonic seizure to recover varies, so it can be several minutes, it could be an hour, or it could be several days to recover from quite a significant tonic clonic seizure. Some people will feel little or no after effects following their seizure, but it depends on the seizure type. So say an absent seizure or a focal seizure, you may have a very quick recovery following this seizure type. Is there any training available for family members, carers, peers from the Trust? If so, how do I access this? What do I do if I don't have a social worker? I can train direct payment carers in relation to epilepsy awareness. Please contact your social worker in relation to this. I'm also happy to receive referrals in relation to supporting service users with a learning disability, carers and peers in relation to adults with learning disability. Please contact me in relation to this. Is stimming or other unusual behaviours often confused with a seizure? How can someone differentiate? Stimming is the repetitive performance of a certain physical movement or vocalisation that is used to self-soothe. Seizure is a partial or complete loss of responsiveness accompanied by body movements and is generally followed by a period of lethargy. It can be difficult to distinguish between the two, but there are generally a change of breathing, colour and responsiveness with seizure activity, and this is not present in stimming activity. My child's epilepsy has been managed within the children's programme of care. What happens when they reach adult age? What should we expect? Is there a transition process? The consultant paediatrician will refer your child to adult neurology when they're about 16 years old. The epilepsy nurse transition is facilitated between the paediatric epilepsy nurses and myself. In most cases, we organise an appointment where the young person who is transitioning will have an opportunity to meet with myself and jointly with the paediatric epilepsy nurse prior to transition to adult services. The young person and their carers will be supported through this transfer into adult services, and I will take over their care when they're 18 years old. What are the risks associated with epilepsy? There are numerous risks associated with epilepsy. Status epilepticus is when someone's having a tonic-clonic seizure or a convulsive seizure which lasts longer than 30 minutes. This is a medical emergency, and in rare cases it can be life-threatening. Other risks include injury and fractures. These may be caused by seizure activity and can lead to increased admissions into hospitals. Medication and side effects. Medication used to treat epilepsy can result in side effects which can be difficult to tolerate, and it's important that the side effects don't outweigh the benefits that the person receives. This is a difficult thing to talk about, but nonetheless it's really important. Sudden unexpected death in epilepsy, which is known as SUDEP. This is when a person with epilepsy dies suddenly and prematurely and no reason for this death can be found. SUDEP affects approximately 600 adults and 40 to 80 children each year in the UK. Many epilepsy risks can be reduced by regular reviews with health professionals, taking your medication properly, avoiding seizure triggers, and taking a positive aspect to your lifestyle and making positive lifestyle choices.